Hi, this is Melody Moore with my community windshield survey. I did my survey in the neighborhood of Chambers Heights in Aurora. This is a Denver metro area in Arapahoe County. Population of Aurora is 276,000. The population of Chambers Heights is around 8,000. East Middle School is where we will be doing our rotation. It's very large, 846 students, sixth through eighth grade. 76% of these students are Hispanic. That is directly reflective of the demographic of this neighborhood. And it is a Title I school. Some community assets, they have a great access to public transportation. The bus stops are about every block on the major roads surrounding the neighborhood. They have great access to the highways, they're very close. And all of these highways connect close to where the neighborhood is as well. And they have a great park and ride station. The neighborhood was extremely quiet with lots of trees and large yards once you got off of those main streets um, surrounding the outside. The housing diversity was awesome. They have single family homes, townhouses, apartment buildings, lovely mobile home community. And the neighborhood sits on top of a beautiful on top of a hilltop with a beautiful view of the mountains when you're looking west. More assets would be their great access to quality health resources, the Aurora Mental Health and Recovery, which works with all age groups from children to seniors, the Public Health Department, the Colorado Family Life Center, which helps people with pregnancy and parenting support. Advanced Injury Treatment Center is a place that provides chiropractic care, physical therapy, massage therapy for people that were in car accidents or workplace accidents, and the University Heights Rehab. It's a skilled short term rehab and long term nursing. And they also have people with living with behavioral health challenges that live there as well. Some of the challenges for this community, they really lack in safe green spaces. Driving around, I didn't see one playground except at a school. So if you were a parent that didn't have a house with a yard, you would have to take public transportation or drive to a playground or a green space for your kiddos. They're lacking in access to fresh food. The only grocery store is in the outskirt of the neighborhood across Colfax, which had a lot of trash on it. It didn't feel safe over there. I mean, the Aurora Public Library is next to that grocery store, and there were bars in the windows. So I had feelings that this neighborhood is probably, that area of the neighborhood is high in crime, didn't feel safe. And the grocery store looked pretty run down, like it needed a good cleaning and some care. Lot of bus stops did not have benches to sit down and wait on, and they didn't have shade. So some of the public health issues that would come from those challenges would be poor nutrition, obesity, lack of physical activity because of the lack of access to the green spaces and playgrounds. This would then make the likelihood for heart disease, type 2 diabetes, other chronic diseases would be, their risk would be higher. The trash on the streets is going to possibly make them more susceptible to getting other diseases because of the bacteria, the insects, and the vermin from the trash. And there's a component of poverty in this neighborhood. 35% of the residents have a high school diploma or equivalent, and 27% do not have a high school diploma or equivalent, which is going to make it harder to find good quality, good paying jobs. The surprising aspect of this neighborhood is that it's very clean and quiet neighborhood, even though Colfax was busy and dirty and loud. And I also found it interesting that no one was parked at the park and ride station, which makes me think that perhaps they're not utilizing their public transportation. Another surprising aspect was the social and economic conditions that goes along with the social functioning of the neighborhood as well. There's a place called La Plaza. It's an outdoor space. They have 37 food trucks and 30 vendor stalls. They're all Hispanic and Latino owned businesses. And they have a very low rent. They only have to sign a 30-day contract instead of a multi-year contract. And they don't do a credit check for these businesses, which is extremely helpful for first time business owners. Um, and they're building a space inside on the same property, and it will be called La Plaza, Colorado. And this is going to really give this neighborhood a huge boost in terms of employment and jobs and community. Um, they're planning on having another grocery store in there, which is great. So I really think they're making a big effort to create more jobs and more fresh food for this neighborhood. They also have the Vasa Fitness Center, which I was very impressed by. They have about everything you can imagine in there. Childcare is also very reasonable, $3 to $5 a day, or 25 to $100 a month. They take care of kids starting as early as 6 weeks old, and the membership fees were very reasonable. Um, they also have job postings that were in the library. Most of them were FedEx, UPS, retail, and cleaning. And the La Plaza, Colorado is really going to add to those job opportunities. Their attitude towards health and health resources, all of the places I mentioned before, they were being very well utilized. And they also have easy access to UC Health and the Children's Hospital. They're very close to those healthcare facilities. They also have great bike paths. I did not see them being utilized, but there are bike paths from the high school to the middle school to the Andrews Medical Campus and then to the Sand Creek Park, the Tollgate Creek Path, which you can see in the bottom picture, was also a really nice green space in that neighborhood, but it did not look like it was being utilized. The Denver Urban Gardens, they partnered with East Middle School and Hinckley High School, and they created actual community gardens. So if you're a community member, you could utilize those gardens and have your own plot there. The advertisements for the Aurora Mental Health and Recovery were on a lot of the park benches in the neighborhood as well. My takeaway message and my application to clinical practice is that just really knowing the community that you're serving as a nurse is going to allow us to care for the whole person and their family, and we can make this community centered. The more we know about their community, the better we'll be able to serve them. And really, a patient's health shouldn't be determined by the zip code that they live in. And as nurses, we can advocate for social determinant of health interventions, and we can work with community-based agencies on initiatives that make change on a local level. So thank you for listening. I hope you have a great day.